Well, let's bring him in. Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital, with us this morning. It's a Wednesday morning. What would it be without Dr. Joe? So with that said, Joe, what do you have for us this morning?
Hey, Ray, kind of interesting to me, but Cleveland fans follow their teams pretty closely, and a little recognized acquisition this week. The Cleveland Cavs picked up Lonzo Ball, who at one time was a very highly regarded star. It looks like he may be replacing some of the minutes of Ty Jerome. That hurts me a little bit. I really enjoyed watching Ty Jerome. What a great year he had. But he's off to another team. The trade was for Isaac Okoro. And Lonzo Ball is with the Cavs. And why it's a medical issue is he has an unusual treatment that he had on his knee called a meniscal transplant. And meniscal transplants are not brand new. A lot of people were asking me, what do you mean by a meniscus? You transplant the meniscus? A lot of my older friends, hey, could I get a meniscal transplant? So let's talk today a little about that. It's been around, really, this procedure for about 20-plus years. And so Lonzo Ball had some real struggles with some bad knee injuries, 22, 20, 23, and 24. He missed 2 full seasons in the NBA, struggling with his knee and just not getting right. And it's an alternative for a really badly damaged meniscus. If you have greater than 50% of the meniscus is torn, it could become a possibility, but there's some really strict criterion that I want to go over with what makes you a possible candidate for this procedure. So, first of all, they, kind of interesting just reading some of the articles. They even know the donor and really thank the donor. It comes from a cadaver, and so he knew the donor, a 20-year-old who passed away, and his meniscus was placed in Lonzo Ball's knee about a year and a half ago with a transplant. And so what happens is they will clean out where that shock-absorbing pad used to be, and they will reinsert a good meniscus, a good cartilage pad, into that spot. And so they did that with Lonzo Ball. It takes a long time for the body to accept this new body part. It's a transplant, just like other transplants in the body that we have. And so it took him a while, but in 2025, he did play 35 games. They managed his minutes a bit, but, I'm told by what I read that it felt good. He really didn't have any significant issues in the 35 games. When the playoffs came, the biggest problem he had was he had a wrist injury, and he missed time for the wrist injury. But the knee was holding up okay. And in the literature, they talk about success rates of meniscal transplants of being about 75 to 80%, though they do say there's about a 20 to 25% need for follow-up surgery at some later date. So that's a pretty high number. And I was talking to, after reading some of these articles, one of my sports surgeons, you're well known around our town, Dr. Kerwin Jones, who's been our chairman at Children's and Copley's team doc for a long time. Kerwin's done these before, done this surgery, not much, but some. And really, it's a shot in the dark. It's when your back is against the wall. It's kind of your last chance, and really strict criteria. So I just wanted to go over the criteria today. Number one, we only do it in people that are less than 50 or 55. This isn't something for older people to have this surgery done. Number two, it's for people that are missing at least 50% of that shock-absorbing cartilage pad, and it's irreparable because we have so many other techniques to get in there and repair it, but there's some that just the cartilage is so beat up there's just no way it's going to be repairable. It has to be, and it's ideal in somebody with minimal or no arthritis at all. And it has to be number three. Number four, it has to be in a stable knee. No torn ligaments, no ligament damage. And number five, certainly not in somebody who is overweight. And so obviously it's complex and it has a higher risk of complications. And there's a couple of professional baseball players that have had this done. There was a gymnast at one time, and this brought back to my memory when I went through this, who landed funny and really tore her meniscus badly. I think she was 17 years old. she had a meniscal transplant done. But we're watching Lonzo Ball this year to see how he comes back. We know that there's a lot of risk. He's 27 now. He was the second overall pick in the 2017 draft, so he had a lot of hype and a lot of hope to his career. But now with this very difficult and complex issue with his knee, the transplant, we'll have to all just sit back and see how it plays out and how he does this year as a Cleveland Cavalier.
Yeah, it should be rather interesting. Joe, on a related note, the NBA announced this week that they are going to look into Achilles injuries and maybe some rule changes. I don't know what in the world they can do with rule changes except for maybe scheduling during the upcoming playoffs. But you and I have talked a lot about Achilles injuries, the stress of these big athletes going up and down the floor. But, from a medical perspective, if they were going to make rule changes, can you think of anything in the world that possibly would be able to help out these athletes that we're seeing a lot in the NBA as far as Achilles injuries?
Yeah, this is exactly how I finished my talk last week. It is at epidemic proportions, and then it was really funny. There were 2 or 3 articles that came out right the day after you and I spoke. I think the sports medicine bodies need to get together and try to come up with a plan for this. Number one certainly is reducing the load, but reducing the load is reducing the paycheck for these people, reducing by games and stuff like that, and so it would change all the records and things like that. How are we going to decrease? The NBA just got done saying they didn't like their stars being out for management. Like 2 years ago, they said they didn't like those games where after back-to-backs, a lot of people would take games off and other things like that unless they had definitive reasons. So reducing the load, it's always overuse is a problem. Looking at preventive PT programs, looking at playing surface. I had a few of my PTs and trainers saying looking at equipment or footwear, changes maybe to the footwear, but we need to put our thinking caps on, and we've got to try to come up with something different because it's just skyrocketing. And those are just a few of the things. I think you're right. I think the number one thing that you mentioned is going to be the playing load and the amount that we get these people to play, and maybe even starting back into high school, college. So many of these travel teams and other things, kids play so many games. I know we don't want to blame everything on that, but overuse is a big issue with this as well. And that tendon may just not be able to hold up under the stresses of that explosive sport of basketball. And we see them a lot in football, exploding off the hard surface of the hard court in basketball and the artificial surfaces in football. So those are all things that we could look at, the surface they play on, the equipment and footwear, and, of course, reducing the load.
All right. Great information, Joe. Listen, my friend, have a good holiday weekend. Enjoy that wonderful family of yours, my friend, and we'll reconnect next week.
Okay, sounds good. Thanks, Ray. Have a great 4th.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He's joined this show Wednesdays for over 30 years.